Hi, everyone. My name is Deborah. My company's name is Solve Speech. @Solve Speech is my Twitter handle, so you can find me there as well. And my website, which is currently being developed, is solvespeech.com. I am an English as a second language instructor and tutor. And as you know, I do live online lessons from time to time. And I also do private sessions. So if you want a private session or want to learn more about the rates, I would be interested in talking to you about that. Just contact me either through a YouTube comment. You can email me solvespeech@gmail.com. You can reach me through Twitter, again, @solvespeech, SOLVESPEECH. And you can direct message me, or you can tweet me. Either way. So I wanted to get online today and talk to you a little bit about some vocabulary. I know that when I'm talking to people who are new to the English language, or not even new to the English language, but have a pretty strong command of the English language, that some of the errors that occur are in the types of questions that you want to ask and how to ask them, and how to answer them as well, especially when visiting a doctor or other medical professional. And now with the coronavirus going around, it is a worldwide pandemic, which is redundant because pandemic means it is an enormously worldwide spread illness. So saying a worldwide pandemic is kind of like saying the same thing twice. Anyway, I'm babbling. So with this pandemic happening, you might be interested in learning some of these vocabulary words. Well, the first thing I want to talk to you about that you might hear on the news or that you might read about and may not be familiar with are some initials that stand for other health-related things. So initials, there's my cat. Her name is Grace, and she may participate and contribute. So initials are letters that are grouped together that represent words. So for example, my initials in my name are D-A-L. D stands for my first name, A stands for my middle name, and L stands for my last name. So if someone were to ask me, what are your initials? I would say D-A-L. There are some initials I wanted to go over with you. Initials, I also wanted to talk about initials compared with acronyms. And acronyms are actually initials that come together and make up a word. So here is a little lesson there for you. I don't have a whiteboard yet, but I'm working on trying to make this more professional, but I wrote it up for now. An acronym is a group of initials that form words. And initials are letters that stand for words that don't necessarily make a word themselves. So an example of an acronym would be NASA, the National Aeronautic and Space Administration. So I could take the N for national, the A for, and et cetera, and put those initials together and just say NASA, like a word, even though it actually stands for the National Aeronautic Space Administration. So some initials for this virus that you might hear. You might hear CDC. and if you haven't, you're probably doing a good job staying at home and keeping to yourself and staying under a rock and not turning on the television at all. But CDC stands for the letter C, the letter D, and the letter C. So you'll hear it when it's spoken in fluent English as CDC. Stands for the Center for Disease Control. Oh my goodness, I don't know what she wants. If I knew what she wanted, I would help her, but I don't. Okay, PCP. PCP stands for Primary Care Provider. FDA. Oh, she's playing. Oh, she's in a mood. I'm sorry. I'm interrupting. Sorry. Okay, she's interrupting me. Now I'm interrupting our session. FDA stands for the Federal Drug Administration. ICU stands for Intensive Care Unit, which is a unit, a department you might find in a hospital. You're not in a regular patient room, you're in an intensive care unit, meaning that your disease or illness is very serious and you need intensive care. And EMS stands for Emergency Medical Services. So, by the way, after I go live and I post this to my YouTube channel, I'm going to write all of these down in the description below, so you have access to these if you wanted to actually read along and as I'm speaking. So my vocabulary that I jotted down, I was watching the news and I was watching some call-in shows, and I just wrote down some words. They may or may not be in order, so I might jump around a little bit. I will try to keep them as organized as possible. Okay, so prescriptions are medications given to you by a doctor. You need a prescription. They write you a prescription. A doctor or physician will write you a prescription so you can pick up medication. You might pick up some antibiotics. You might pick up some anti-anxiety medications, but you need a prescription for these types of medications. Speaking of medications, another word they call medications is drugs, but to kind of keep it medical, I would say medications. What they're talking about with the virus is they're looking for a vaccine. They're developing a vaccine. And a vaccine is when they put the live virus inside someone's body so that they create an immunity. And so they're developing that now, according to the news. By the way, I'm not a physician. I am a speech language pathologist at a skilled nursing facility. So I'll talk a little bit about that in later down the line in this video. But so what I'm getting here is just from my own basic knowledge throughout my own experience in life, as well as a little bit extracted from my own experience working in the medical field. Okay, so we have prescriptions, drugs, vaccine, immunize, immunization, and antivirals. I've heard this. This is a new word I hadn't heard before, but I looked it up, and it is when there's a class of medication that helps prevent viral infections, I think. And I got that from Wikipedia. So antivirals is a new thing you'll hear a lot probably in the news. Okay, so we talked about a pandemic. A pandemic is an illness that is spread worldwide. And then compare that with the word epidemic, which is an illness that is spread locally when a high number of people in a community have a disease. But what this coronavirus is currently is a pandemic because it's spreading worldwide. Let's talk about symptoms. So before I talk about symptoms, I want to talk about some words associated with the people at the highest risk for the coronavirus are people with conditions, other health conditions that exacerbate the symptoms of the coronavirus. So symptoms are the like the feelings or things that you're experiencing. So a headache or a fever could be a symptom. Now, I'm not talking about symptoms of the virus. I'm just talking about symptoms in general. Because like I said, I'm not a physician. So symptoms in general of anything. What are your symptoms? A physician might ask you, or someone screening you might ask, what are your symptoms? Do you have a headache? Do you have a fever? Do you have a cold? Do you have any congestion? And notice the question patterning that I'm using is do you have? And so we're looking at the symptoms being nouns. Do you have a, or do you have any? So listen for those being nouns. And then as I move on, we'll kind of talk a little bit about the grammar there too, as needed. So do you have any cramps? Do you have any pain? Do you have any bloating? Do you have a fever? I said that before. I'm trying to think of some other symptoms, but if you're watching and can think of some symptoms you want to comment there, that'll be fine too, and that'll kind of add to the dialogue. I would appreciate that. What they ask me every day I walk into work, I do a screening. The person screening me asks me several questions about where I've been, who I have talked to, and who I've been in contact with, and what symptoms I have, if any, and what symptoms anyone I've been in contact with has. So I do a screening every day, and I go to work and they take my temperature. They put the thermometer under my tongue and they wait a second, and as long as it's under 99, I am clear to work. But we'll talk about work and things like that, how this is affecting me personally in Central Virginia and the place where I work, and maybe I'll kind of elaborate on some of the things my friends are experiencing as well. Okay, so we talked about symptoms. We talked about conditions. Now, we didn't get into conditions, but I'll do that now. People at the highest risk of the most severe cases of coronavirus, from what I've heard on the news, is that they have conditions that, such as chronic conditions like they already have lung infections. They have like COPD. People at higher risk are also older. Some words for older people, we can call them the elderly, as in a noun, and elderly can also be used as an adjective when you say elderly people. Okay, so you can say the elderly, meaning the population, or elderly people when you're talking about a group of people. I don't really think there's a significant difference in one or the other. People at higher risk are in long-term care facilities. There are also other healthcare professionals, such as doctors, nurses, and surgeons. And this information I got directly from the CDC website. You remember what CDC means from earlier, don't you? Center for Disease Control. Another word for doctor is medical provider. Another word, expression. Another expression is for doctor is primary care physician or primary care provider. Okay, conditions. So conditions are like chronic illnesses, people with severe illnesses, people who are hospitalized. Okay, so hospitalization. Hospitalization basically means you are admitted in the hospital and staying there. You're going through a hospitalization stay. Another word associated with conditions, another expression is chronic conditions. And these are conditions that they have. I'm not laughing at the content. I'm laughing at my cat. She just seems to know exactly when I'm recording and does this a lot. And okay, back to you. Chronic conditions and chronic diseases. These are ongoing and typically don't have a cure. They're more managed than cured. I'm kind of jumping back and forth here, but I will say we have first responders is another word that I heard on the news the other day. It goes along with the expression EMS. That's initial standing for emergency medical services. These are your first responders, the people who respond when you call in an event of an emergency. Let's see. When you're in a hospital or a doctor's office, I actually went to a doctor's appointment today, I thought to myself, I know the recommendation is to stay home. The facility did not cancel the appointment. It was kind of up to me to cancel it if I was going to cancel it. But I thought, what cleaner place could I, or more disease-free place could I be than in a doctor's office? And it was true. When I went in, I had my exam. They said, come back out and check out, because when I check out, they call the person in their car and they say, now you can come in. And they're literally, we had this, what they call social distancing. And this is another expression I'll get to in a minute when I talk about that subject. But there's this social distancing where they don't want people to be too close together. So that happens, and that happened today. And I went in, and I was the only one in the waiting room, and I was the only one in the back. Excuse me. And then, so where was I? Stay at home. Okay, so when I went to the doctor's office, you notice there's another set of initials called PPE, personal protective equipment. And this includes gloves, like your rubber gloves, the face masks, and the gowns that they wear to protect from diseases, airborne and contact. So that's something that you'll see in medical facilities, gloves, gowns, and masks. And I heard that there's a shortage of masks because all of the masks that are, I guess, in stock in the country are going to medical facilities, and rightly so. So there's that. Back to symptoms. I'm kind of skipping around here, and I'm sorry about that, but I just saw on my list here. I did mention fever, but another symptom would be cough. Do you have a cough? And do you have difficulty breathing? So those are two other symptoms I wanted to mention. Okay. In grammatically speaking, I wrote down this list of what to do. And grammatically speaking, these are called imperatives. They're commands. And commands are essentially sentences that do not start with a subject. They just start with the verb, as in, do this, don't do that. So it's going to start with a verb. So for example, I'm going to read a list of commands that you'll hear during this time in this time of change in our world. Wash your hands. Notice I didn't say you wash your hands, and I'm not asking. It's an imperative. You should, you must, but I don't have to say you should wash your hands. Wash your hands. Just do it. Just do it. It's an imperative. Just do it. Wash your hands. Use hand sanitizer. When you sneeze, cover your nose or mouth with a tissue, or they do the elbow sneeze, chew, like that. Dispose of or throw away your tissues in a lined trash can. Stay at home. And those are the commands that I have heard. Oh, avoid contact. Avoid contact with people. Maintain social distancing of 6 feet. Avoid public transportation, and avoid touching your face. So notice the grammar structure in all of these sentences just starts with a verb and then ends with the object. And so those are, again, they're commands, they're imperatives. So if you wanted to do a little bit more studying on commands and imperatives, you can Google it, but those are some examples that we'll hear in this day and age. So we also have staying at home, maintaining they call it social distancing. This is a new expression that I've never heard before. I don't know if it existed before this, but language is fluid and things get invented, words and expressions get invented and adapted all the time. So social distancing for me is new, but this is what the CDC is recommending that you don't go near people. And if you are out, if you do have to be out to get food for necessary things at home, to get food, to get pet supplies, to get necessities for daily living, to maintain a social distance of 6 feet. And I don't know what that is in meters, but if someone wants to pop in and right, do the feet to meters translation for me, please do so. I can do it, but I don't want to take up the time at this moment. But I might put that in the comments, in the description below as well. Let's see. So a lot of this is causing a disruption in people's day-to-day lives. For example, one of my best friends, she's a teacher, and well, schools are closed. And a week ago, when we first discovered that schools were closed in the state of Virginia, they started out being closed for 2 weeks. And now 1 week has passed, and now we don't know how long schools will be closed, or what kind of other changes to social events and social gatherings are going to happen, and when we'll be able to resume normalcy. So there have been some, in actually the last video that I made, in the last video I went live, I mentioned how this disease, the coronavirus, is affecting my life. And I said, well, it's not really affecting my life, except before I might have given someone a hug, whereas now I, tap their elbow. But now I do. I keep 6 feet distance, and I don't leave my house if I don't have to. So there have been a lot of changes in a week. What a difference. Well, Aretha Franklin said, what a difference a day makes. But I mean, it could be a day. Tomorrow, we might find out something completely different. But what a difference a week makes, because now, let's see, restaurants are converting to carry out or delivery to stay open. Businesses are closing. Non-essential employees are being laid off, which may lead to unemployment. People are experiencing a little bit of stress because of they are not sure what their financial situation may be. People are experiencing some fear, and rightly so, in terms of, will I catch it? Will my elderly parents catch it? Will my children catch it? I notice I'm using catch because you can catch. Well, you can catch a cold. This is just an expression in English. Now, catch is usually the physical, tangible verb of like catching a ball, like you throw a ball and then you catch it. But using that analogy to kind of stretch your imagination and think of catching as you can also catch a disease that is contagious. You can't catch a non-contagious disease. I don't know why I'm laughing. I'm laughing at myself because when I start to think of how words are, like the word catch for a disease does sound kind of funny when you think about it. But nonetheless, this is just how we speak in English, in American English. So people are experiencing stress and anxiety about the disease itself and the spread of it. When will it end? Is this the end of the world? Is this going to affect me and my family directly? Are people in my family, my loved ones, going to die? And these are really very serious concerns. And also, in conjunction with that, there's another added level of, will I be able to support my household and my family if I lose my job, or if my employer decides I am no longer needed at this facility until we are certain that the virus is no longer putting us at risk, us or anyone else at risk. I just wanted to mention also, I did kind of talk about it already. I do work at a long-term care facility. It's actually it's not just long-term care, it's long and short-term care. And I'm a speech therapist there, and I help people with speech and swallowing and memory, and, well, just to name a few, but there are a lot of other things that I do, and under the scope of speech language pathology. Being that the residents at my facility are in the high-risk category, we are extra cautious of who we let in and out of the facility. So another thing, something else people are experiencing stress and anxiety over, especially the residents at my facility. Our facility is on lockdown, and this is a vocabulary word you might hear on the news. Lockdown is when people can't come in unless you're an essential employee. At this point, they have not locked down my facility, but they have stopped allowing visitors to come in and out, only staff. And of course, the residents who live there are, they're there. They're not going anywhere unless they get discharged. But what that means is, think about it. In a long-term care facility, you have elderly people whose, maybe one source of their joy is having their family visit on the weekends or, during the week, or taking them out for a day. And right now that can't happen. And personally, I'm getting a little melancholy here, but personally that saddens me because I can see it in some people's demeanor, and it's kind of decreasing their morale. And as a therapist, we want to boost people up so that they get better. But I can see it kind of decreasing people's morale, and it makes me sad because this is happening and because it's out of our control. So I am going to close for now. I noticed that I have one viewer left, and thank you for sticking around for the whole time. If you have any questions, go ahead and write it in the comment section, or I'll go ahead and answer it. And if you happen to know me personally, you can text me a question. That's fine too. And I'm going to do a quick plug on what soft speech is and does, and then close it out. So soft speech started under another name called All English. And that was, I'm Deborah, and that was the Deborah from over a decade ago, 14 years ago. So I've been doing this for over this one-on-one computer tutoring for over 14 years. I've been an English as a second language instructor since 1996. Not to date myself, but okay, I'm in my 40s, so you can probably do the math and figure it out. It's my passion, and it's my first love, and it was my first career, and it actually, that introduction into the world of languages sort of was my pathway to becoming a speech language pathologist. And I also love what I do. And but I wanted to kind of get back into English as a second language for a little while because it is my first love. And so anyway, I changed the name of my company, and I'm redirecting the types of services that I offer. Mostly online. I could do in person, but I am in a rural area in Central Virginia, so online might be more convenient. I do live sessions like this online for free, and you're more than welcome to join and comment. I also do one-on-one. I haven't explored with groups online, but I do one-on-one tutoring. I can charge by the hour or by the minute or by the assignment. So if you have any questions concerning English, language, grammar, pronunciation, articulation, what else do I do? Writing, reading, listening, conversational speech, business English, in a variety of professions. Well, and if I haven't mentioned something that you might be interested in, then go ahead and ask me if I do offer that service as well. So I do one-on-one, and you can reach me at Solve Speech, my Twitter handle, and you can reach me through YouTube, and you can also reach me through my currently being developed website, www.solvespeech.com. And there's a contact page there, which I think leads you to YouTube and Twitter. I don't remember if I put my direct phone line on there. So I'm looking to develop a community here, and so keep in touch and follow me on Twitter and subscribe to my channel. And thank you for staying tuned. Bye.